This is something that we see a lot of students struggle with, so what we're going to try to do is try to simplify it, okay? So we're going to kind of start with our basis, and then we're going to build on it, and we're going to see how, when we start to look at our cardiology, and we start to look at like congestive heart failure and those things, how when we understand this cardiac blood flow, it's easy for us to start to recognize, if this right-sided, left-sided congestive heart failure based upon like the symptoms that we're seeing with our patient, okay? So if we start with the basics and we look at our heart, okay? So now we understand that the heart is not actually a square. This is because I can't draw, and this will help us simplify it, okay? So when we look at our top chambers, we have our right atria and our left atria, and then we have our right ventricle and the left ventricle, all right? Now, when we look at this here and we look at our atria, all right, these are going to be our receiving chambers. So this is where now the blood is returning to the heart, okay? The ventricles, these are our pumps. And we're going to see when we look at this, we actually have two circulatory systems when we look at the heart. So if we would kind of divide this down the middle into right and left sides, right? So when we look at the right side, and remember that we're always looking at the patient's right. So this is now, if the patient is facing you, this is their right side. So if I were to turn and I'm looking at the patient, even though this is my left, everything that we do is always patient's right and left side. And that can also kind of start to confuse people a little bit. So as we start to look here, the right side of the heart, this is what we consider our pulmonary circulatory system, okay? So the right side of the heart has deoxygenated blood. All right? So the right side is receiving blood that has already been used for metabolism, right? Metabolism, work of the cell. So now what we have is that byproduct, right? Our carbon dioxide-rich blood, our deoxygenated blood, that's returning back to the right side. And now that deoxygenated blood, the right side, the pulmonary circulatory system, this is where now it's going to pump over to the lungs. We're going to exhale, get rid of all that carbon dioxide-rich, take in a nice breath, bring fresh oxygenated blood, and now that is going to come into our left side of the heart. Now we're going to have oxygenated blood to be able to go through. Or on the left side, we have our systemic circulatory system, okay? So now, systemic is referring to the body system. So when we say systemic infection, it means that multiple body systems are involved, okay? So now when we look at the right side, this is where now we have oxygenated blood. All right? So when we look and we kind of trace this blood flow, all right, we know that we have some absolutes. We know that arteries, high pressure system, all right, my handwriting is atrocious, I was beaten by nuns, all right, so didn't make writing any better. Arteries, always away. So I'm not that bright, so I need to find ways to memorize things. Artery starts with A, always starts with A, away starts with A. Arteries, always away. This is universal. Always. Always away. All right? Most of the time, arteries have oxygenated blood, but not all the time. So, when you start to look at, especially when you're looking at test questions, you want to read those descriptors. So when it says, always, it's always away. Most of the time, arteries have oxygenated blood, okay? Veins, low pressure system, and they always carry blood toward the heart. Veins have valves. So again, veins, valves. These valves, in healthy vasculature are now going to prevent backflow, okay? So these, universal. Most of the time, veins have deoxygenated blood, but not always. Always, veins carry blood toward the heart, okay? So now when we kind of come back and we start to look at this, we trace our blood flow. So we have our great vessels, so we have the superior and inferior vena cavas, and this is now that the blood is returning back to the heart and is dumping into this right atria, okay? So now we have it received on this right side, deoxygenated blood, and now before it can go to this ventricle, now we have, the valves of the heart that we have to look at. So, if we come over here and we look at our valves, there's a little mnemonic to remember this. So, the order, toilet, paper, my, acids, right? So now when you look at this here, this gives you the order of those valves. When we break down the valves, so when we look at them, we have atrioventricular valves, and we see them as AV valves. And these mean that they are valves that are between the atria and the ventricle. That's how they're named, atrioventricular. So they're between the valves. Now what it's doing is, ideally in a healthy heart, it's preventing backflow once the blood is pushed into the ventricle, preventing backflow to the right atria. We're going to see, in our sick patients, especially congestive heart failure, when we start to have problems with some of this valve and we start to have a sick heart, we're going to start to see that backflow, and now it's going to start to cause this engorgement of our vasculature, or JVD. So when we look at our atrioventricular AV valves, we have two. So the first one is the tricuspid. Okay? So the tricuspid is named because when you look at the shape of it, it has three pieces that come together to make the valve. Three. Okay? So it's named for its shape, which we see a lot in our anatomy. The other AV valve is over here. So this is the bicuspid. Bi meaning two, so they have two pieces that come together to make this valve. It's also known as, because it wouldn't be medical terminology if we didn't have at least two, maybe three, four names for the same thing. It's also known as the mitral valve. Okay? So that's where this M comes in, the mitral valve. So it's better known as that. So when we look at it again, it's for that shape. So if you ever look at like Catholicism, you look at the bishops and you look at the big hat that they wear. Again, I can't draw, but you got a little, that's a cross. This by two, so that mitral, that's kind of what we're looking at. Okay? So then we have another class of valve, and these are known as our semilunar. All right? So these are also named for shape, semi being half, lunar being referring to the moon. Okay? So the semilunar, we now have our pulmonic, and we have our aortic. All right? So now as we start to kind of trace this, we have our superior and inferior vena cavas. They dump into the right atria. So we have our deoxygenated blood returning here. It goes through our tricuspid valve into our right ventricle. Right ventricle is the pump, and this is the pump that's going to pump this deoxygenated blood over to the lungs. So it's going to go through our pulmonic valve, and now we need to carry it away from the heart. So it's now going to go through the pulmonary artery. Now, artery, like we said, is always away. But here in our cardiac circulation, this is where we have an exception. This, the pulmonary artery, is carrying deoxygenated blood. All right? So it's taking the deoxygenated blood that's returned to this side, and it's now pumping it over to the lungs. So now we have our exhalation. We get rid of our waste products, our carbon dioxide. We take in fresh oxygen. Oxygen now leaves the lungs, and it goes through the pulmonary vein. So remember, veins always toward, but here's that other exception. So now this is where, because it's coming from the lungs, we've just taken in a nice breath. This is where now the pulmonary vein is carrying oxygenated, all right, oxygenated blood. So the pulmonary vein carries blood back to, it dumps into the left atria. Left atria pumps through our mitral or bicuspid, same thing, different names, also known as bicuspid or mitral valve, into our left ventricle, and the left ventricle is what we consider kind of the workhorse of the heart. So the left ventricle, remember the left side is our systemic circulation. So the left ventricle now pumps through the aortic valve, and it goes through the ascending and descending aorta. Okay? So now when we look at this, once it goes through that ascending and descending aorta, it now carries oxygenated blood through our arteries, top of our head, distal phalanges, all the way down to our toes, everywhere in the body. All of our organs, everything, every cell in the body requires a consistent supply of oxygen, of glucose, and water, right? So now this, the left side of the heart, is what pumps that into our systemic circulation, allowing all of the cells of the body to now get their oxygen, okay? So this is, kind of simplified. This walks us through this cardiac blood flow, where it starts, how it travels, how we can kind of delineate things, especially, this is important, for all levels of healthcare. But now we start looking at, when you're looking at those test questions, well, which of these is an AV valve versus a semilunar valve? And we're going to build on this in our next segment, and we're going to look at, when we look at congestive heart failure, and we start tracing things backwards, we're going to be able to start now breaking down some of the symptoms to figure out what's going on with our patient, okay? So hopefully this is helpful. We have some of our all the time, so look at those questions and make sure that you're looking at, is it an always, is it a most of the time? Those things that are going to help you kind of answer these questions, all right?